with an incidence of 0.016 to 0.036% in North America and a mortality rate of 100% if left untreated. Hypoplastic left heart syndrome is one of the most severe congenital heart defects that causes 25 to 40% of all neonatal cardiac fatalities. According to an article published in News Medical Life Sciences on February 26 of 2019 by Dr. Lee Thomas. Hypoplastic left heart syndrome is one of the most multifactorial and difficult to treat of all the congenital cardiac diseases. So it is essential to understand this disease's complexity. Many people are not aware of this cardiovascular disease, but it can affect any child. So whether you are a person interested in learning more about the body's physiology, know someone with a rare disease, or are a parent expecting a child, understanding rare diseases complexity is beneficial. A person who is very close to me was born with this disease, so I have a thorough understanding of hypoplastic left heart syndrome. This also inspired me to become a family doctor, and I have already done a lot of research and questioning in this area during my courses. Today, I'll be talking about what is meant by hypoplastic left heart syndrome, its symptoms and causes, and the treatment strategies that have evolved over the years. First, I want to begin talking about what is hypoplastic left heart syndrome, then I'll move on to its symptoms and causes. In order to deliver oxygen and nutrition to the body, a healthy heart pushes blood through the circulatory system. There are two chambers on the right and two on the left of the heart. These two chambers are used to pump blood, which is controlled by small door-like valves that open and close to allow only one direction of blood flow. However, in the condition of hypoplastic left heart syndrome, the left side of the heart is severely underdeveloped, which alters the normal blood flow through the heart. Medical Dr. Lee Thomas stated in February 26, 2019 edition of News Medical Life Sciences that in hypoplastic left heart syndrome, the left side of the heart can't adequately pump blood to the body. This is due to the left ventricles, which is a lower pumping chamber, insufficient size or absence. Also, she says the major artery leaving the heart, the aorta, is smaller than usual, and the valves on the left side of the heart, the aortic valve and mitral valve, which divides the heart to left chambers, are absent or similarly deformed. Babies that suffer from hypoplastic left heart syndrome frequently have a ventricular septal defect or a hole between the left and right upper chambers of the heart. This means the baby's blood will not flow correctly. And in this case, the blood must be pumped via the right side of the heart to the body as a whole, as well as to the lungs. As a result, the right side of the heart must do twice as much work to pump blood. When this happens, the baby's blood vessels will be damaged, and this puts them in a dangerous condition. After giving you an insight into this birth defect, let's get started with the symptoms related to this disease and its causes. Hypoplastic left heart syndrome has different symptoms, which can be detected through an ultrasound in the second trimester of pregnancy before delivery, or a fetal echocardiography can also be used by specialists to determine the severity of the abnormality if detected. After birth or a few days later, parents or the doctor could start noticing that the baby has breathing difficulties, cyanosis, which is a bluish color around the lips and mouth, a pounding heartbeat, and a weak pulse. According to an article written by Christo Chervenkov, et al., published by Cambridge University in Cardiology in the Young. These warning symptoms should be taken seriously because they might prompt parents to seek medical attention, since they suggest that the baby is not obtaining a sufficient amount of blood and therefore might have a congenital heart disease. For this reason, it is also important to consider the different known causes of hypoplastic left heart syndrome. Following Christo Chervenkov et al.'s information, there is no underlying cause for developing hypoplastic left heart syndrome, as with the majority of congenital heart abnormalities. Even though the cause is unknown, a variety of factors, including the baby's gene, could be the cause. While little is known about the genetic pathways producing hypoplastic left heart syndrome, there's a significant amount of evidence for its genetic etiology. Certain congenital cardiac defects affect some families more frequently than others. So parents who have a child born with hypoplastic left heart syndrome have a high risk of having their second child also developing it or other heart birth defects, unfortunately. While the symptoms can be overwhelming and the causes are not always clear, I want to discuss the different treatments available today and their effectiveness because hypoplastic left heart syndrome does not always have to be fatal. There are several treatments available for babies born with hypoplastic left heart syndrome, ranging from medication to transplants and surgeries. But the improvements in care have enhanced the prognosis for babies born with this defect. According to Robert Gobris, et al. In the journal Acta Medica Lituanica, 30 years ago, there were no effective treatments for this pathology, and the disease's normal course resulted in death, generally during the first few weeks of life. But now, more than 50% of patients can survive for 5 years due to recently discovered surgical palliative methods. There are three possible directions for therapy in newborns with hypoplastic left heart syndrome, which are orthotopic heart transplantations, state surgical palliation, and palliative non-surgical treatment or comfort care. The best option for a child who is born with hypoplastic left heart syndrome is to have a heart transplant or open heart surgery. However, this is difficult as there are limited heart donors. When this is not an option, parents can try state surgical palliation, for example, the Norwood operation, which is another choice that can be taken in the first few weeks of life. Another newer form of treatment that has emerged recently is fetal therapy. Yet the only way to survive until a heart transplant is through stage palliation and full fountain circulation. These will occur as an alternative to open heart surgery as it will fix the cardiovascular system without being as invasive. But in terms of some circumstances, the newborn cannot be stabilized and no treatment is suggested. If there are no surgical choices, comfort care is provided to have the family. Even though this might be discouraging, parents should not lose hope and keep looking for alternative options. So as I discussed today, hypoplastic left heart syndrome is a rare at-birth defect that affects normal blood flow through the heart. It has several symptoms that can be identified before and after birth. However, there is no known cause for this congenital disease, but it is thought to be related to genetics. And through the medical advancement and recent advanced treatment, the children who are born with hypoplastic left heart syndrome now have a higher survival rate. Understanding the intricacy of hypoplastic left heart syndrome is crucial since it's one of the congenital cardiac conditions that is most complicated and challenging to treat, even with the current medical advancements. Even though this disease is very rare, it is a very devastating one that can cause death in a short period of time, which I know from personal experience. However, no matter what, if the disease is hypoplastic left heart syndrome or just it's a different birth defect, parents and others in the community should learn as much as they can in order to notice the signs and symptoms before the defect develops.